kamustahan. So what does kamustahan mean? Actually, literally, it is translated as what's up or how are you? It's a genuine asking on how is the state of being of another person. The mental health and psychosocial support services started with a simple conversation with the Disaster Risk Reduction Management Office staff of Pasig City. During the height of the pandemic, we've asked them what is the need of our partner local government unit. And they said what they really need is to help them handle the stress that they have, the community as well as the first responders. And so we've decided to come up with a program that would help first and foremost the first responders. Why them? Because they are the ones who respond in every scene during the pandemic. We've asked with our partners who are very good in mental health and psychosocial support. Our partner In Touch, they help us develop our program for MHPSS, and also with our local partner in Pasig City, which is the Pasig Adventist Community Service. They said that they would provide snacks as well as hygiene kits for the responders, or what we call the carers. This program is caring for the carers. So we have food, we have hygiene kits, we have the coordination with the local government, we have CDP, we have In Touch as facilitators of the sessions, then we have the participants. Those first responders, with doctors, we have doctors also from other LGUs. We have nurses, ambulance practitioners, and as well as admin staff in the traffic aid, or anybody who are responding to this pandemic. And so this went on first in Pasig City, then it went to Quezon City, and then it went to other areas. We even have like in Makati, in some portion of the hospital, and then we went to other provinces all throughout the Philippines, handling this simple program that we had. But this did not really push and flourish without the help of the other partners. We started with a small fund that we had, and then of course our partner from Philippine Preparedness Partnership, funded by the APP, they help in sponsoring the making of the modules, developing it more, and making it into a kit, as well as the case stories from these interventions that we had. This program, by the way, we called it Kamustahan. So it's a Filipino culture of usually asking people how they are with a sincere heart, you know. And so that starts the conversation, actually. We start from asking them, if you were given a superpower, what would you choose? And why? From that conversation, they would answer usually what superpower they would need in their service. And usually, they would say all these things in the context of the problems that they have and the stresses that they have. They would also tell us in the context on how they would want to help other people always, you know. So that is a really very good start in the conversations. And then from there, we ask them, so after knowing all these stresses that you have, stresses from the family, for fear from the sickness, loss of jobs, those things, no? Those are the problems that they usually have. And of course, problems in the mobility from transferring from their houses, going to the workplaces. They need to go to the workplaces because they are the ones giving services. But now, since all the public transport are canceled, so they really have a problem in the mobility. So all those things are small and big things that compiles the stresses that they have. Then big time is that when they realize that one of their family members have COVID, or they themselves have COVID. So these are big issues and big things that really touches their hearts. And so we ask them, how did they cope with those things? How did they go, they move forward from these things? And then they would now tell their stories, their coping mechanism, their resilient attributes, so to speak. These are the source of their strength. Amazingly, most of the Filipinos and the first responders that we've talked to have these 3 F's: faith, family, and friends. And of course, there are all other things like watching teleseries or Korean novellas, or watching Netflix series, or probably they are also keen and also happy with the plantita, or gardening in their houses, whether it's urban gardening or rural gardening. And then of course they also have this talking with friends online, chatting with friends online, gaming, and of course they cannot go out, no? So what they did was they do online selling. So somebody will do different pastries and then sell it to others. That's a good source of income, at the same time good source of relieving their stress. So there are different things that they do, and they would say, oh, some of them would continue to do their work because they say it inspires them to help other people. So these are the resilient attributes that we've seen with the people. They would also say that their colleagues or their work environment can help relieve their stress. Sometimes not, but at the same time, sometimes it's their source of strength. So whichever their resilient attributes, we try to highlight it. Upon hearing from each other, it helps them. It helps them relieve their stress. At the same time, affirms them that they are not the only ones having these problems, but other people too. And they have different coping mechanisms that they can copy, or they can also emulate. So those things. Then after that, after summarizing the resilient attributes of the group, we also try to give tips on how to cope up with stress. So we have this breathing exercises. You can do a bit of the breathing exercise, like when you breathe, try to breathe like a baby. You breathe like a baby. You have your stomach gets bigger when you inhale, and then you release it. Then it of course, your air also releases. So you inhale, hold, exhale, inhale, hold, exhale. One more time. Inhale, exhale. Breathing, let's do it 6 times or 10 times. That would be great. You do it like you do PBA. Pause, breathe, and accept. You pause first if you're like so stressed out and you really want to shout and you really want to punch somebody. Stop. You pause first. Try the breathing exercise 6 to 10 times or whenever you want. Then after that, try to accept the situation, that you're already in this situation, and then try to assess on what you should do. It helps you a lot. It helps you see things clearly, and it helps you relax. Okay, so that's one tip, no? Breathing exercise, remembering the resilient attributes, and then also you can also write journals. Yeah, we have this what we call appreciation journals, wherein every day you write at least one thing or 2 things or top 3 things that you would like to thank for this day. Every day you do that, and then after some time, you develop a habit of positive thinking. because you tend to see the things that you should be thankful for. So that's another tip. Then, of course, after that, in our session, we encourage them to make that as a group, a psychosocial group wherein they can encourage each other, saying what's up to each other, just to check on the stress level of each other, and then try to tell stories and share stories of resilience, you see. So that's what we did in those areas. So hopefully this short sharing with you would also help you have programs, simple programs like this. And you know, this is a very good impact to our partners. They would say, we were thinking that 3 hours for 10 people to share their stories, that would be too much. It might become boring or something. But at the end of the day, every time, they would usually say, that 3 hours is just so little. We want to have more. We want to have more conversation. It's like a year or several months that we had this COVID. This is the only time that we had these talks. This is the only times that we were able to share each other's feelings. So it was really very good. But of course, we did this with also careful consideration of the participants. We have an assessment of the participants that will come with our program. We made sure that these participants do not really need the highest level of intervention or the experts, so to say, but just like a psychosocial first aid. If the stress level are high, yes, we can join these groups. But if they could no longer function, or if they try to hurt themselves, then we try to refer them to the experts, doctors for mental health. So that's also one thing that we should remember, of course. I remember one of the doctors said, before she thought that she didn't need these sessions. But after having the session, they realized that is exactly what they need. The MHPS session that we did. Another would say, it is relieving to hear that you're not the only one having these problems. That your colleagues are also having the same thing. That sometimes you do not really want to say it because you're afraid, you're fearful of what others will think about you. But because during those sessions, there are we have this confidentiality clauses. We only say that you can share only what you want to share. So that's why they say it's really good. Most of them, even those who are the one managing our MHPS sessions, they said these are the things that they would need, not only for the frontliners, but also for the communities. We have a book of case stories of the frontliners that we have talked to. These case stories are already compiled, and you can see that on screen. Read on it and enjoy what they said after having these sessions that I am sharing with you. And of course, we also have a module for this. These modules are sponsored by the Philippine Preparedness Partnership together with the APP, ADPC, and hopefully you can also access it. If you need further stories or further questions on these intervention, very short and simple intervention that we did, you can always go to our website and look for us, okay? So, guys, what's up? When you say what's up, it's really asking you what's up with you. We're hoping that everything is well with you and hoping that everything will be well in the future. But for now, let's do this thing together. Let's help each other. And let's share stories that can inspire and help us to become resilient. Thank you very much again. And again, for mental health and psychosocial support, 2 thumbs up for everyone. And hopefully, you would also embrace this program. Thank you very much. And God bless.